Okay, now the concern is why we need to change the dental restoration. Dental restoration, mainly the dental amalgam, we need to change when there are two concerns. First is your breakdown. If there is a breakdown of the restoration, that old restoration, it may be 5 years, 10 years, or 20 years back. So we have to change the restoration. And the second concern is your aesthetics. Sometimes a patient needs to change the black color restoration, that is a silver amalgam, to the white form, and white form is your composite restorations. So as far as changing of the restoration, there is one concern that if it is very bulky or is very deep, then we have to look for the sensitivity case. If it is very sensitive, then we have to apply the base layer, that is a medicament. Over that we can put the composite restoration. Even then, if it is sensitive or pain in the tooth, then we have to go for the root canal treatment, and after that we can do the crown. For more information, consult your endodontist. Thank you.